Well, hello, everyone. Thank you very much for being here. My name is Morgan Richard, and I'm a PhD student at the University of New Brunswick. I'm supervised by Dr. Lucia O'Sullivan, and I first want to respectfully acknowledge that the University of New Brunswick stands on the unsurrendered and unceded traditional Wolastoqey land. The lands of Wabanaki people are recognized in a series of peace and friendship treaties to establish an ongoing relationship of peace, friendship, and mutual respect between equal nations. The river that runs by our university is known as the Wolastoq, along which live the Wolastoqey, the people of the beautiful and bountiful river. The Wolastoq is also called the St. John River. Today, I'm going to be discussing with you cancer and communication, about the cancer experience and communication between couples. I'm training to become a researcher of social psychology, and my area of expertise is close relationships. Essentially, my job is to conduct research to learn more about why people behave in certain ways in close or romantic relationships. And I want to share with you my current research project and some of the previous research in psychology that led me to develop my current study. And there will be time for some discussion throughout the presentation. However, I encourage you to feel free to ask me any questions throughout the presentation, or I will also open up time for questions at the end. According to the Canadian Cancer Society in 2019, cancer is the leading cause of death in Canada, and nearly 1 in 2 Canadians are expected to develop cancer in their lifetime. Research on cancer and communication has practical implications for cancer survivors and their partners, their families, and providers about the relationship impacts associated with the emotional toll of cancer. The findings from this type of research will advance our knowledge of how couples experiencing cancer communicate about cancer and provide ideas for social interventions to help offset feelings of isolation and distress for individuals and couples going through this increasingly common experience. It's well known that having regular, open, and honest conversations with your partner can help offset some negative effects of difficult life experiences. However, cancer and the prospect of death are particularly challenging experiences. No matter what we are experiencing, why are some things simply difficult to talk about? We've kind of all felt that way. And I'm sure, we can think of those times or those topics that, we wanted to bring something up to someone, but we ended up saying nothing at all. Where does that feeling of awkward topic avoidance or uncomfortableness come from? Topic avoidance is the idea that people steer clear of certain topics and conversations with their partners or other people in general, and that this topic avoidance plays a role in their relationship. One theory argues that couples have simultaneous concerns of being open to share and being unwilling to disclose. People desire intimacy and closeness, yet they also desire autonomy and protection. Couples continuously balance privacy and disclosure concerns. Through topic avoidance, partners can protect themselves and their partners, as well as maintain their privacy. Psychology theorists have suggested that cancer-related stigma may be driven by fear of the illness itself and by fear of death. So this means that people may avoid individuals fighting cancer because they fear having to fight cancer themselves. This conceptualization of cancer-related stigma is similar to terror management theory, which is a theory that suggests death anxiety or anxiety about death underlies many social behaviors and motivations. Terror management theory says individuals reduce fear of death by actively employing defense mechanisms such as avoiding discussions about death, concealing illness, and avoiding terminally ill individuals. These defense mechanisms are something that help people maintain a sense of meaning and order to their life. Research suggests that exposure to another person's illness or disability evokes fear of suffering the same fate, and psychological distancing, meaning that we may try to not think or about or acknowledge those individuals. So it sort of influences us to psychologically distance as well as physically distance ourselves from those individuals. Observing the physical vulnerability of others may impair our defenses against death awareness, resulting in a greater death anxiety and social avoidance of affected individuals. Hope has been defined as the possibility of a better future in the context of uncertainty. The amount of hope of family caregivers of cancer survivors surveyed by one study was found to be significantly less than the people they were caring for. Partners' experiences of hope was situational, so the amount of hope that they had was influenced by many personal factors such as spirituality, positive outlook, level of support, and relationship with family members. A study conducted by Duggleby and colleagues in 2012 examined the experiences of hope in partners of breast cancer survivors. Many participants talked about how engaging hope and finding balance, discovering what works, and focusing on the positive were derived in those feelings of hopelessness, lack of control, sudden changes, and distress. They described their hope as always being there, though they were not always aware of it. And one person suggested what worked for him was open communication with his partner. And I actually have a quote of his on the next slide, which I will read. Being open and willing about the degrees of support that can be provided, and some of them will be expressed by my wife, that if I could do this or I could do that, it would be very helpful to her because she had wished to do this and this at the time, so I can do that. That's something tangible, and that's right up a man's alley. So for these individuals, what worked to maintain hope included finding ways to support their partners, tangible ways to support their partners by being open, present, and listening, and finding healthcare information to help make informed decisions as well. I just want to pause here to acknowledge that every couple has different ways of communicating and different experiences of sharing their emotions with each other that are normal for them. From birth, based on the nature of our relationships with our parents or caregivers, we develop certain attachment styles. And some of us may naturally feel very confident and secure in a relationship, while others may feel anxious and worried about keeping the relationship maintained, and others still may avoid close intimacy with their partner altogether. Research is beginning to show that we each have kind of multiple attachment styles, like differing degrees of these different attachment styles, based on our different experiences in close relationships throughout our lives. So that means the types of relationships that you had as a young adult and in your teenage years, and the connection that you had with your parents really does influence the way that you connect and bond with your close partner later in life. And so for some people, it may be very easy to express how we're feeling. Maybe that's something you've always done. Whereas for others, it may feel impossible to put into words how they're feeling. Also, every couple enters their cancer journey at a different stage in their relationship with unique ways of communicating. So, it may be that a couple is doing the best they've ever been when they receive the cancer diagnosis, or maybe they're as distant as they've ever been when they receive diagnosis. So no matter how much we learn about cancer and communication between couples, there will not be a directive answer or like a communication recipe for all couples to follow, because every couple is different. And importantly, everyone's experience of cancer is different too. Hopefully, through research, we can build an evidence-based argument to say that making couples aware of communicating together about cancer is important towards their emotional coping and relationship satisfaction. One psychological theory suggests that talking with others facilitates cognitive and emotional processing of experiences such as cancer if the social context is supportive and positive. So that means that we're better able to process what we're going through when we're surrounded by a supportive and positive social network. The quality of a relationship, whether it's good or bad, is in large part determined by the type of communication that happens between those two people. A recent research review in 2018 found that the quality of one's close relationships was strongly associated with reduced anxiety about death. So now let's look at partner communication and emotional stress in the cancer context. People diagnosed with cancer often do not adjust to their cancer alone, but share their concerns that are brought up by the cancer with their families. Managing the emotional stress of their survivor, in addition to managing their own distress, has been identified by partners or family as their most difficult task. Interestingly, in heterosexual relationships, women play a unique role in the couple's overall coping with the situation, according to one study that was done in 2008 with spouses of women who had been diagnosed with breast cancer in the past 6 months. And so what this study found was it's just that when a couple is dealing with a major illness such as cancer, the extent to which the woman psychologically adjusts to the situation plays a key role not only in their own well-being, but also in their spouse's well-being. So that suggests that helping specifically women better adjust to their own or their partner's cancer would benefit both partners, at least in heterosexual relationships. Partners of cancer survivors often adopt a caregiving role and report feeling overwhelmed and unprepared for the challenges of this role. Spouses described feelings of shock and disbelief, helplessness and fear, and sadness. They reported worrying about the extent of the disease, cancer reoccurrence, and what the future might bring, as well as their wives' survival. A few spouses reported feeling guilty about not being able to do more to help their wives and were self-critical about their own inability to support her. Spouses talked about their difficulty in waiting for test results and waiting for surgery to be over, all those different types of situations. They also found it hard to watch their wives struggle or be in distress. And some spouses felt angry with their wife's physician. They experienced her doctor as patronizing, uncaring, or disregarding of them. Spouses felt guilt at their own inability to protect their wife from what was happening or felt they were not doing enough to support her. Spouses described themselves as not being able to take on more than they were already doing, physically or emotionally. So some spouses reported that they spent time as a couple talking about the cancer and that they worked to keep the communication open between them and that their communication had improved because of this. For other spouses, the cancer was felt to negatively affect their relationship, including challenging their communication as a couple. And these participants also discussed difficulty with talking to their wife about their cancer. These difficulties including her not wanting to talk about it, finding talking about it was difficult due to the gravity of the situation, and feeling talking did not necessarily get them anywhere. They differed with their wives in the extent to which they asked questions about treatment, wanted to talk to others about the cancer, or explore the emotional side of the experience. Spouses' experiences of getting support vary greatly. Although some men appreciated and sought help from others, others chose not to talk about what was happening. Some reported receiving support from others, where others said they were abandoned by their friends. Some men took time for themselves, whereas others did not. And some kept their feelings to themselves when little support was offered to them by others. Some kept feelings to themselves because they did not want to burden their wives. And for some, their wives did not always want their spouses to talk about the cancer or to talk with others about the cancer. And this is all obviously an enormous amount of stuff for a couple and an individual to navigate. And likely while struggling with grief and distress and this complete change in lifestyle as well. So research shows that some cancer survivors too have these similar challenges with communicating openly. So I've been talking a lot about the partner, but from the research that I've read, survivors also feel these challenges with communicating openly. Heightening their distress further is a tendency for supporting partners to avoid disclosing their emotional struggles to their partner as a form of protective buffering. And protective buffering is when someone hides their worries or denies concerns that they have in an effort to reduce their partner's upset and burden and to avoid having a disagreement. Health practitioners can make couples aware of the benefits of sharing feelings and how they could be helpful to one another. And this may introduce the idea to them that sharing feelings with one's partner is legitimate and possibly beneficial to both members of the couple. It sort of legitimizes this communication as something that can help, not just maybe an idea, but more factual almost if you hear it coming from your practitioner. Throughout the cancer experience, many couples react as an emotional system rather than as an individual only, and how they communicate and interact with one another in dealing with cancer may bring them closer together or have other positive effects for them. And empowerment can be defined for the cancer context as a person's feelings of being able to manage the challenges of the cancer experience and of having a sense of control. To help people establish that, information targeting each of the individuals in the couple that promotes the use of collaborative approaches, so like techniques that they can kind of work on together, is needed to help the couple members empower themselves in facing cancer. So the question then becomes, what should this information for couples involve? This was a study by Bayliss and colleagues that was published in 2014 about cancer survivor and partners' evaluation of advice messages for heterosexual couples that were found in documents prepared by national cancer organizations from Canada, the US, and the UK. They held focus group discussions with cancer survivors and partners of cancer survivors. Both groups, survivors and spouses, agreed on the importance of communicating about cancer. Several spouses expressed a certain reserve about sharing their own feelings and fears, given their concern about adding burden onto their partner who already had a lot to deal with. And remember before I talked about how every couple is different in the way that they communicate and connect together in the first place. This study found that the regular nature of communication in the couple's life would influence how they communicate about cancer. So if partners struggle to communicate before, then they would likely be challenged to communicate after a cancer diagnosis as well. So these are those advice messages for heterosexual couples that were found in those national cancer documents. And so these are just the messages that were specific to communication. And most of the messages are relevant for both members of the couple. They kind of have it split here, messages for the woman, messages for the spouse, but because there's no line in between most of them, that means that they are relevant for both members of the couple. So I'll just read what these advice messages were. Be willing to listen to one another. Don't just talk about the cancer, talk about regular everyday things and events too. Don't assume that you know what your partner is feeling. Talk about your fears concerning the illness, but also about other difficulties that you have coped with successfully together in the past. Be aware of each other's feelings and encourage one another to talk about them. And then this specific message for the spouse, crying can make you feel better. So I'm going to show you what cancer survivors and their partners thought about these advice messages on the next few slides. So I'll show you now what the responses were to these advice messages. So there's the first one here, be willing to listen to one another. A spouse said, be attentive. It's obvious, so obvious that I wouldn't even have included it. And a survivor says, this makes me react right away because I think the sentence is a bit meaningless in the sense that it's really easy to say, too general. And in fact, I don't know what it teaches us to do that we don't already do. And the second one, don't just talk about the cancer, talk about regular everyday things and events too. So the survivor says, we talk about cancer and we talk about other things. In fact, that's the point. We want life to go on. And that's what we try to do. To the greatest extent possible, have the impression that life goes on normally. And the spouse said, I think there's something imaginative and constructive missing. Create projects, talk about the future, be positive. So this person wanted more of, more tangible, directive ideas of what these regular everyday events could be for them. And an author comment there, participants mentioned that this was important not only with regards to their partner, but also with regards to their family and friends as well. And the third message, don't assume that you know what your partner is feeling. And this survivor said that we tend to think that we know everything about our partner, but in fact, both of us keep some things to ourselves. And the spouse says that they would change the wording to get through this, you have to communicate. So that don't assume, how that starts as don't assume was maybe a little too aggressive. And yeah. The fourth one, talk about your fears concerning the illness, but also about other difficulties that you've coped with successfully together in the past. The survivor says, my partner was so encouraging sometimes. He said, in a while, this will all be over, and think about the fact that we'll have gotten through it. Think about everything we've coped with, we'll get through this. A spouse said, I believe that you have to talk about this stuff right away. Talk about what's worrying you, what you're afraid of. Another spouse said, in the past, we succeeded in getting through other things together, and there's not just cancer, there are other things that we've coped with in life. And one survivor also said about this, one thing is for sure, if you didn't communicate before, if you were living separate lives in this regard, you're not going to start because of illness. And another spouse said, talk about your fears. There's no way that I'm going to start talking about my innermost feelings and the rest. I want her to share her feelings with me. So this one is just interesting to see, these are all different people and they're all going through a similar experience and reacting to the same message, but it kind of shows you just a little tip of the iceberg of the way that each couple is different, each individual is different in how they would choose to communicate with their partner in the first place. And then this last one here, be aware of each other's feelings and encourage one another to talk about them. A survivor said her partner never told me how he was feeling. I often asked him, I kept asking, are you worried? How are you feeling? He answered, no, think about yourself. I would have liked to hear him say, yes, I am worried. And a spouse said, one thing is for sure, it won't be, I guess I said this one, me, who will start telling her my innermost feelings. So that one, they're just not willing to maybe share their feelings. Again, that might be something they've never done. And I just wanted to share these because remember that these are advice messages that came from national cancer organizations in Canada, the US, and the UK. So this is one of the main sources of advice that couples are seeking on communication. And look at the criticisms that they have, clearly there could be a lot more development that we could kind of put into these advice messages to make them a lot more helpful. A study that was published in 2006 found that approximately 30% of cancer survivors, all of them women, reported frustration over their perception of their spouse's denial of their illness. Approximately 36% of participants reported avoiding or having difficulty discussing the cancer itself. Almost 83% of spouses talked about the perceived importance of their staying upbeat and focusing on the positive to provide their partner with a sense of hope. Almost half of all spouses, 42%, were reluctant to talk to their partners about their own feelings of depression or anxiety. Spouses also reported difficulty talking about the toll their partner's cancer was taking on themselves. Sex was reported as a topic that was difficult to discuss, and this is found across many other research studies as well. Whereas 12% of participants reported a decrease in conflict since they had been diagnosed, 64% reported an increase in conflict since they've been diagnosed. So 12 plus 64 doesn't equal 100%, which means that the rest of the couples would have reported no change in the way that they've been in conflict since diagnosis. So majority in this study particularly reported an increase in conflict. And participants identified several examples of healthy relationship functioning in the area of communication and spousal support. For example, couples reported a greater focus on their relationships after a cancer diagnosis. Participants also reported changes to the nature of their communication. Specifically, their conversations became more serious. Couples talked about the relationship memories to help their relationship memories help them focus on the positive in times of stress, while others talked about relationship memories to focus on their accomplishments and shared connection to others, such as their children. Discussions also included end-of-life concerns, financial arrangements, and leisure plans. The results of this study suggest that social constraints such as denial, avoidance, and conflict may hinder open communication about cancer between couples. And assistance during times of adversity is a strong determinant of well-being. So you're more likely to have a better well-being, a better life satisfaction when you have support during those hard times in your life. In addition, earlier studies suggested that spouses' criticism and avoidance may have negative effects on the survivor's cognitive processing of cancer, but open communication may have positive effects on intimacy and psychological adjustment for both cancer survivors and their spouses. So these findings show that some spouses feel constrained in discussing their own needs, such as sexual intimacy or their emotional reactions to the illness, whereas cancer survivors may feel frustrated that their spouse is not sharing those needs and concerns. So in terms of helping support couples experiencing cancer, it seems as though targeting the couple rather than just the individual is important because a strong, close relationship may help protect against psychological distress. Couples may benefit from information that includes a communication component that addresses both their survivors and partners' needs. So kind of like those advice messages of how to communicate that would be applicable to both the survivor and the partner. And of course, you know, there will still need to be advice that is specific to the individuals as well. But when we're developing these types of intervention and ways to better support couples, we should be trying to do that by gathering information about the couple together rather than kind of in a siloed way looking at survivors and looking at spouses, because ultimately they're coping with this experience together as a unit, as an emotional unit. And so researchers like myself need to learn more about how couples communicate about cancer with one another and how different ways of communicating influence their overall relationship satisfaction and experiences of hope and grief. And so that brings me to my study. which I'm currently running, and it's entitled Open Communication, Withholding, and Relationship Strain for Couples Dealing with Cancer. This study is funded by the federal government through a Social Sciences and Humanities Research Council of Canada grant, and it's part of my PhD research program that's supervised by Dr. Lucia O'Sullivan at the University of New Brunswick. This study aims to increase understanding of how cancer survivors and partners of cancer survivors talk about illness and the prospect of death. Cancer survivors or their partners who have experienced cancer within the past 3 years are invited to complete an online survey. And so this survey takes approximately 20 to 30 minutes to complete. And, if you are a member of a couple and you wanted to maybe complete this survey, your spouse or partner certainly does not have to complete it if they don't want to. It's up to you as a survivor or as a partner to complete the survey. And everyone, of course, is 100% allowed to stop taking the survey at any point if they become uncomfortable during it, or choose not to send their responses to me at the end of the survey. We also ensure that once your responses are sent in, all identifying information is completely removed from your data, and your responses will never be seen by anyone except the researchers, but also particularly by your spouse or partner. I understand, that's a concern where you are talking about your relationship, and that's something that your partner will never be able to see, or anyone else aside from myself and my supervisor. So we help to identify possible avenues for improving education and information for individuals, partners, families, and providers on communication and relationship dynamics for couples experiencing cancer and the emotional toll of cancer on close relationships. This research could lead to further investigations, such as cancer stigma and healthcare providers' communication with cancer survivors. For each person who participates, $5 will be donated to the Canadian Cancer Society by the researchers. And I would be happy to answer any questions that you have about the study after this presentation, or via email as well, which I will have my email on the next slide. And thank you very much for your consideration in participating. I also believe this poster and survey link is going to be distributed after this presentation as well. So I can also have the PowerPoint presentation distributed too. So everyone will have the information and my speaking notes as well. So you remember kind of everything that we've learned today. And that brings me to the end of my presentation. Thank you very much for your attention, and I'm happy to open the floor to you now to discuss further or answer any questions that you may have. And that's my email there as well, so feel free to contact me anytime about anything.